Hello, I'm Robert, and this is a short version of my video that I just uploaded on the 10 things that most people don't know about how to protect yourself and your loved ones, recommended by the World Health Organization. And first, most don't know to isolate from their own household. They don't know that if you've got COVID, that most likely you haven't passed it on to anyone else in your household. And health workers wouldn't dream of looking after COVID patients without taking precautions. And in the same way, anyone else in your household shouldn't dream of looking after you if you've got COVID without taking the right precautions to protect themselves. And these you should check out the World Health Organization's precautions and follow them yourself. Then most people don't know the emergency symptoms for COVID. And it's basically if your oxygen levels are falling. And so get an oximeter. They don't cost much. And contact emergency if your oxygen levels fall. Trump was whisked to hospital right away, and you should contact them right away, and they will likely take you to hospital in an ambulance. The reason is, and that's also including unusual breathlessness, where, for instance, you're too tired, you're in bed and you get breathless just lying in bed, or just walking upstairs, or something that would normally not be your baseline would not be breathless, and yet you get breathless now. If that happens, then contact emergency right away. So many people, you will likely survive if you try to home treat it, but so many people have died trying to home treat lack of oxygen because there is no remedy for it. And you will likely be started on dexamethasone. And then 3, about soap. Then so many people think, oh, I've run out of hand rub, what am I going to do? It should be the other way around, that soap is the best choice by far. And use hand rub does work as well, but soap is just instantly, it just explodes the virus if just one soap molecule gets to it. And you just follow the advice and cover every part of your hand with soap. Do it like Dr. Tedros shows in that video. And then most people don't know about quarantining. As soon as you discover your contact, immediately, without hesitating, quarantine away from the rest of your household. Again, that is by far the priority, especially in lockdown. And because you're most likely not yet infectious. If your contact, the virus is in your body, it may be in your body if you have been infected. Most contacts don't get infected, but if you have been infected, then the virus may be in your body, and yet you're not yet infectious. And it could be days, could even be a week or more before you become infectious. And you become infectious 2 days before you show symptoms. That's the point in quarantine, to make sure you don't infect others, that you're not the basis of a super spreader event before you become infectious. And Mark Ryan, I shared this video, he says, he's very plain and blunt, that that this is the reason. This is basically the reason why the cases increased after summer in Europe, because we're not doing quarantine properly. He doesn't think anyone in Europe is doing this systematically, but you can do it. And full advice on how to quarantine, discover how to do it. It'll be the links in the video description. And then most people don't know you can do your own contact tracing. They think it's something government has to do. The contacts will be people you know. It's not the person you sit next to on a park bench. If you didn't talk to them, you're not a contact. You're a contact if you talk within 1 meter for over 15 minutes, or lots of short contacts, that add up to 15 minutes in a 24-hour period. So bring up anyone who is a contact right away. Remember, the sooner the better. As soon as you know that you've got COVID, as soon as you test positive, then you should be ringing up these people and saying, you're a contact, and suggest that they quarantine to protect their household, and try to explain it to them, as most people won't understand this and won't know why they need to quarantine. And then support them as best you can. The government should be doing the supporting. They're not doing much in most countries, so you just do what you can from your side. And then most people don't know how effective physical distancing is. They know you're supposed to do it. They don't realise how important it is. And it's like not doing physical distancing is like trying to cross the road without looking both ways. Especially if you live in a city and you cross the road many times, you just automatically look both ways whenever you cross the road. And it should be like that with physical distancing. And it's the ventilation helps, but it doesn't protect you if you talk face to face within 1 meter of someone, outdoors or indoors. And so do everything, all the good habits, and especially if you do nothing else, do physical distancing. That's absolutely vital. And most people don't know that you need a lot of virus to get infected, and this particularly comes up with, so that just says a single virus of adenovirus can infect you, but it will infect you almost certainly. But it's not the same with COVID. It's like several hundred viruses. And this is why close contacts and talking within, and that's why they say 15 minutes. That's long enough for several hundred viruses to get across to you from the other person. Whereas 1 minute, you won't get many viruses come over. And many people, they worry about, they buy some food in the shops and they take it over, or they get a parcel delivered, and they're so worried and scared about that. And I'm much more often asked about that than about physical distancing. People get very scared about just packages, and then they touch the package or something, and then they worry that means that they've got COVID. And there's no evidence of COVID being spread on food packages. And that's what the World Health Organization say. So if you're worrying about that and you're not doing anything about physical distancing, you're focusing in the wrong place. There's no harm for peace of mind to wash these things when you get them from the shop, when you get packages delivered, but that's not where the risk is. The risk is for physical distancing, with a long chat you had with your neighbour or friend, and that's where you could get COVID-19. And then most people don't know that you can avoid the COVID fatigue with automatic habits. And like I showed Dr. Tedros' that video, I recommend you play that video and just do what he did. Follow the same things that he does, and then it become habit. And once things are habit, it's like what I said with crossing the road. You don't stop and think and wonder, should I look both ways? What should I do? Or even, what should I do when I cross the road? You just automatically look both ways and then cross. Especially if you live in a city and you frequently cross roads. You don't just cross the roads without looking. And so it's like that. It should be an absolute habit. Whenever you meet up with someone, step back. And that's better for the other person too. It makes it easier for everyone. They know that you are the person who steps back and does physical distancing. They will always expect you to do that. Hopefully you influence them to do the same as well. Just always do it. Except in situations where obviously for your job or some reason you can't do it, then the mask is so important. And it's the same with the mask. Then read up the proper instructions about how to wear a mask. Follow them and go through them all, like learning a musical instrument. Do it 1 or 2 times and it'll soon be a habit. And then you'll do it properly. So many people just don't do it properly, like they touch the front of it. You should never do that. But it just so happens, it happens that with COVID-19, then masks do work pretty well, even with people being so sloppy. But do it properly. And then most people don't know how random COVID is, or about long COVID. So there's no condition that makes you safe from COVID, except being very, very young. Under 20, and especially under 10, your risk is just about 0. Apart from being very young, there's nothing that makes you really safe from it. And there's long COVID, which mainly affects the younger people. And then there's, you're elderly, then you've got a significant risk of dying of it. And so this is my Russian roulette graphic. That young people risk, it's like most people survive Russian roulette. So if you have lots of friends and they all say, nothing happened to me, that does not mean that you're safe and that you don't need to protect yourself. Most people do survive Russian roulette. Most young people will not get long COVID, but 1 in 6 or maybe 1 in 10 or something like that will. You get different figures. It's really quite hard to research. And then if you're over 90, then it's very similar to Russian roulette, the number over 90 who will die. And again, if you're a 90-year-old, most of the other 90-year-olds maybe haven't died, but you should still protect yourself from COVID-19, even though you see elderly people on television and some of them get COVID-19 and seem perfectly fine. But they were the lucky ones in this Russian roulette. They could have died. And then, you need to become a superhero in your community. And these are all the things that I talked about and some others. The face coverings, do that properly, make it all automatic. Contact tracing you can do yourself. Physical distancing, then step back. And vaccination, that's for the governments when it comes. Then vaccination will help protect you. Hand hygiene, there's the quarantine, do that properly. Stay informed, and as well as staying informed yourself, inform others. When you've got people around you who don't know about this, then you need to tell them about this. And so I don't think I need any. Those are the main points. The government needs to step up its game. It really does. But if you're in any position of influence, then try and see if you can get them to give more support, more information, get this information out to people. The future looks good. With the vaccines, then we should see a fall in the deaths and the number of people who are in intensive care units sometime February, March, because of the delays involved in the time to get them vaccinated and the time from then to when the actual intensive care units or deaths happen. But we can stop it much faster by doing this. If we do this, then we don't have the delay until you're vaccinated. You don't have to wait until you get the vaccine. And most of us won't get the vaccine until months later in late spring. But we can do this right away, and it's good. It's better than the vaccine. With the vaccine, there's one chance in 20 still that you get infected if you're doing risky behaviour, a 20th of the risk you would normally have. But if you do physical distancing, then it's much less than that. It's as safe as crossing the road and looking out for traffic. And the people like Mike Ryan in Geneva, and he uses public transport back and forth to the World Health Organization headquarters. He does the same thing as the rest of us are doing. He does it really systematically and carefully, and in that way he's protected from COVID-19, even using public transport in Geneva, which is the hotspot of COVID-19. So all of you, do this. Take these precautions. It's even better than a vaccine. Then once the vaccine comes, then that can then be used to bring it right down in the few places where it's left. But if we work together, if we all do this, the more people that do this, the sooner we'll be able to start bringing it down. And the reason we are in lockdown, most people don't realise this either. The only reason we are in lockdown is because people aren't doing these things.